One of the reasons why we wanted to talk to you, Dr. Fauci, was because the African American community has been hit particularly hard by coronavirus. We have disproportionately high infection rates, hospitalization rates, and death rates. Can you help me, first of all, make sense of why that's happening, how we can make up 13% of the country with such a high number of infection?
Yeah, Mark, it's a what I call a double whammy against the minority, but particularly the African American and Latinx community, and that is we don't like to generalize,
Yeah.
but as a demographic group, that the African American community is more likely to be in a job that does not allow them to stay at home and do teleworking. Most of the time, they're in essential jobs. I mean, obviously, there are a lot of African Americans who are not that could just as easily do that. But as a broad demographic group, you're outside, you're exposed, you may be in a financial or economic or employment situation where you don't have as much control over physical separation, which is one of the ways that you prevent infection. So the likelihood of your getting infected is more than the likelihood of someone not in your position.
Mm.
The other side of the coin, and this has a lot to do with long-term social determinants of health. As a demographic group, African Americans have disproportionately greater incidence of the underlying conditions that allow you to have a more unfavorable outcome, namely more serious disease, hospitalization, and even death.
Mm.
That is diseases like diabetes, hypertension, heart disease, obesity, chronic kidney disease. If you look at populations as a whole, and you look at the demographic group of African Americans and the demographic group of the rest of the population or Caucasian, what you see is a much greater incidence. So you have two things going against you. You are physically in a position that's more likely you're going to get infected. And if you do get infected, you're more likely to have a serious outcome. To me, the thing to do is we need to focus and concentrate resources in those areas that are overrepresented by African Americans. In other words, allow you to get tested more quickly, results back quickly, and access to health care. We can do that right now, today, if we concentrate resources.
How do we get the most vulnerable people, particularly poor Black people, access to healthcare, access to preventative stuff? What kind of resources could we redirect?
That's it. What we can do is that there are a number of ways to do that, is to get, first of all, a greater awareness of the need that if you're African American and you get infected, it is more likely you're going to have a serious outcome. So we've got to just get a public awareness on the part of clinics and hospitals that you have to pay special attention, that you have someone at a greater risk. And when you know you have someone at a greater risk, you make certain medical decisions. You maybe get them in the hospital earlier. So we've got to educate people on that. The longer term one is something that you're not going to cure overnight, and that is the economic and other conditions that African Americans find themselves in, that they're not in a situation where they can have a greater access to health care from a more of an economic standpoint. But the other thing that I think we need to make a commitment that goes probably measured in decades, and that is, why do African Americans have a greater incidence of hypertension? Why do they have a greater incidence of diabetes? Why do they have a greater incidence of obesity? It's not genetic. It has to do with years and years of access to the right kinds of food, access to the right kind of health care. Those are the things that we've got to change. But that means that perhaps if there's one silver lining in this outbreak, which I hope there is always some silver lining in everything that's so challenging as this, is to focus with a laser beam on the disparities in health that we've got to change. And it's got to change at the fundamental basic level. It's not going to be tonight or tomorrow or next week. It's going to be over the next several years.
Are
So,
you
And right when people think about this outbreak, they say, hey, let's pay attention to this because it's another example.
Skepticism, healthy skepticism, and reasonable wariness of the American medical establishment in the African American community, right? I mean, whether it's the Tuskegee experiment, whether it's our inability to access pain medications at the same with the same pain levels as our white counterparts in hospitals and emergency rooms. I mean, we've had very bad experiences with American medicine for hundreds of years. A whole bunch of black folk don't want to get this vaccine. Some are scared of the idea of it. How do you take that into consideration? What kind of steps are done to recruit people for these trials? What do we do?
No, great question. And we, in fact, are addressing that. You are absolutely correct. I mean, we have a history that has gotten much better recently, in the last few decades, but a bad news history going back to things like Tuskegee. And also, I think it's good that you made that comment about pain medication. It's true. I mean, we have African Americans who have sickle cell disease who come into the emergency room in terrible pain. And, there's sometimes a reluctance to give them the pain medication that they need. So those are the kind of things that it's understandable why there's skepticism among African Americans regarding the typical classical medical establishment. So what are we doing about it?
Right.
It's called community engagement and outreach to the community, where we are leveraging the community relationships that we started years ago with HIV, something that I started when I started the HIV program at the NIH, that we developed relationships with community reps who were trusted by the African American community because they were reflecting the African American community. So I often joke, but it's the truth. You want to go into the African American community with people who look and think and act like the people you're trying to convince. You get a white guy with a suit like me and a tie on going in talking to people who are people that you don't usually relate to every day. But if you get the community people on the ground to go in and say, hey, let me tell you, I've scoped this out. This is something for your own benefit. In addition to people like myself saying the same thing. So when you see people in authority and people at the community level saying the same thing, hopefully you can get the African American community to essentially do things for their own benefit, because it's for your own benefit to protect yourself from this infection. It's going to take several months before you determine whether it works or not. You can't guarantee that it will be effective. We're trying to find out if it's safe and effective. We should know that by the end of this calendar year, sometime in November or so. How do we believe that, or do we believe it would be effective? I think if you look at the early results from the phase 1 trial, I can say, although I can't guarantee it, because you never can guarantee anything with vaccines because of the vicissitudes of whether or not it's going to be effective, that I can say that I am cautiously optimistic that we will have a vaccine that will be available by the end of this year, the beginning of 2021. When will we have a situation where we'd be able to distribute it in a meaningful way? I think somewhere into 2021, we might have a vaccine. And again,
like first quarter?
I hope so. I think you're going to have maybe tens of millions of doses by the first quarter. I don't think you're going to have enough for the entire country in the first quarter. But I think by the time we get to the end of 2021, if the vaccine is successful, and I always say if because you never can guarantee, if it is, I believe as we get well into 2021, most people can wind up getting vaccinated.
Dr. Fauci, do protests increase the spread of the virus?
Do protests increase the spread of the virus?
I think I can make a general statement.
Well, 500,000 protesters on June 6th alone.
Yeah.
I'm just asking that number of
No.
people. Does
Yeah.
it increase the spread of the virus?
Crowding together, particularly when you're not wearing a mask, contributes to the spread of the virus.
Should we limit the protesting?
I'm not sure what you mean. How do we say limit the protesting?
Should the government limit the protesting?
I don't think that's relevant to.
Well, you just said if it increases the spread of the virus, I'm just asking, should we limit it?
Well, I'm not in a position to determine what the government can do in a forceful way.
Well, you make all kinds of recommendations. You make comments on dating, on baseball, on everything
No.
you can imagine. I'm just asking you. You just said that protests increase the spread.
No.
I'm just asking you, should we try to limit the protests?
No, I think I would leave that to people who have more of a position to do that. I can tell you.
Government stopping people from going to church, Dr. Fauci.
Yeah.
Last week in the Calvary Chapel case, 5 liberals on the Supreme Court said it was okay for Nevada to limit church services. Justice Gorsuch said it best. He said, "There's no world in which the Constitution permits Nevada to favor Caesar's Palace over Calvary Chapel." I'm just asking, is there a world where the Constitution says you can favor one First Amendment liberty, protesting, over another, practicing your faith?
I'm not favoring anybody over anybody. I'm just making a statement that's a broad statement that avoid crowds of any type, no matter where you are, because that leads to the acquisition and transmission. And I don't judge one crowd versus another crowd. When you're in a crowd, particularly if you're not wearing a mask, that induces the spread.
It's a simple question, Doctor. Should we limit the protests? Government is obviously limiting people going to church. And look, there's been no violence that I can see at church. I haven't seen people during a church service go out and harm police officers or burn buildings. But we know that, for 63 days, 9 weeks, it's been happening in Portland.
Right. Yeah.
Well, one night in Chicago, 49 officers were injured. But no limit to protest. But boy, you can't go to church on Sunday.
I don't know how many times I can answer that. I'm not going to opine on limiting anything. I'm just going to tell you.
You've opined on a lot of things, Dr. Fauci.
Yeah, but I've never.
This is something that directly impacts the spread of the virus, and I'm asking your position on the protest.
Yeah, I'm not going to opine on limiting anything. I'm telling you what it is, the danger, and you can make your own conclusion about that. You should stay away from crowds, no matter where the crowds are.
Government has stopped people from going to work. In fact, just in New Jersey 4 days ago, Ian Smith, Frank Trombetta were arrested for trying to operate their business, their gym. They were arrested. But my bet is, if these two individuals who own this gym were outside just in front of their gym, and all the people who were working out in their gym were outside protesting, they'd been just fine. But because they were in the gym working out, actually running their business, they got arrested. You think that's okay?
I'm not going to opine on who gets arrested and who does not. You get where I'm going. I'm telling you, as a public health official, I say crowd.
Do you see the inconsistency, though, Dr. Fauci?
There's no inconsistency, Congressman.
So you're allowed to protest, millions of people on one day in crowds yelling, screaming, but you try to run your business, you get arrested? And if you stood right outside that same business and protested, you wouldn't get arrested? You don't see an inconsistency there?
I don't understand what you're asking me as a public health official to opine on who should get arrested or not. That's not my position. You could ask me as much as you want,
you've advocated for
and I'm
certain
not gonna
businesses.
answer it.
You've advocated for certain businesses to be shut down. I'm just asking you on your position on the protest. I haven't seen one. We've heard a lot about hair salons. I haven't seen one hairstylist who, between haircuts, goes out and attacks police or sets something on fire. But we've seen all kinds of that stuff during protests, and we know the protests actually increase the spread of the virus. You've said that.
I said crowds. I didn't say specifically. I didn't say protest do anything.
So the protests don't increase the spread of the virus?
I didn't say that. You're putting words in my mouth.
No, I just want an answer to the question. Do the protests increase the spread of the virus?
I don't have any scientific evidence on anything. I can tell you that crowds are known, particularly when you don't have a mask, to increase the acquisition and transmission. No matter what the crowd is.
So you don't have a position on whether the protests increase the spread of the virus or don't increase the spread of the virus?
I'm saying that crowds, wherever the crowds are, can give you an increased probability that there's going to be acquisition and transmission.
But do you understand Americans' concern? Protesting, particularly according to the Democrats, is just fine, but you can't go to work, you can't go to school, you can't go to church There's limits placed on all three of those fundamental activities,
Legitimate.
First Amendment activities, but protesting is just fine.
Greetings to the divine family. Welcome to Black World TV, the new black media. Today's broadcast is about Dr. Fauci, and as you heard him speaking about this vaccine and COVID-19, the coronavirus, it's interesting how he mentioned that Native Black Americans, foundational Black Americans, are disproportionately greater affected by coronavirus from underlying health conditions such as diabetes, heart disease, chronic kidney disease, hypertension, and lupus. It's interesting how he mentions those health diseases for black people, but other ethnic backgrounds are not even discussed or considered. I find that highly problematic. He says that there are two things that are against black people in particular is that we're more likely to have a serious outcome and physically in a position to be more likely affected, and that meant being an essential worker per se. And while I'm on that point, let me just point out that this is the reason why I mentioned that this subject is about racism, because then we're dealing with racism at work, because it just so happens that at these companies that are really white supremacist organizations have black people in these positions to where we are vulnerable. And so even no matter what job we do, there are ways around making us vulnerable. For instance, since you know that this is a problem with black people, why are you having us go to work during this pandemic? If this virus is so detrimental to life itself, why are you even asking black people to go to work? If you're allowing white people in particular to work from home because they're in a privileged position, if you're allowing them to work from home, why not allow all your employees to stay at home so that we can combat this virus, as you say, that's so detrimental to our health? Why aren't you companies doing the right thing and paying without any conditions, paying even your black employees who have to stay at home because of this pandemic? That would be the smart thing to do. That would be the most intelligent thing to do. Black people shouldn't be penalized simply because of the roles that we play at any given company. If we're good for the job while things are good, we're just as good for the job while things are bad. So I hope you picked up on many of the points that I made sure to make different gestures within the broadcast so that you could pick up on some of the things, like when Dr. Fauci, and I'm going to call him Fauci, so that way as I don't keep saying his name right, but Fauci, that's foul and then chi, Fauci. I find him very problematic in the structure of things that he said, especially when you have to consider, how is a virus race specific unless it was designed that way? And then we need to really raise the demands of reparations, because see, reparations is at the heart of this issue and problem. Because see, if Native Black Americans, foundational Black Americans, ADOS, American descendants of slaves, if we were compensated properly by this government, I must say that again, if we were compensated properly by this government, by reparations, and I'm not just speaking on just economics, because we want you to cut the check. Cut the check. But we want land so that we could build upon. It's funny how there's such a hatred for black people, but when we discuss the issue of wanting to separate from you, you turn the mirror around and call us racist for wanting to get away from you. I find that very problematic too. But when you say that we're more likely to have a serious outcome, there are plenty, and there have been plenty of white people who have died from the coronavirus, or the COVID-19, if you will. Plenty. So we're not the only ones more likely to have a serious outcome. Dr. Fauci. Let's be honest. So, Divine Family, I hope you picked up on the part where he spoke about how to get our attention in the communities by sicking, like a dog, sicking other black people who look like you and I, so that we would trust them to go along with what Zaddy says. That's basically what Dr. Fauci had to say, is that they put their flunkies, their bootlicks, within our communities so that we could look at them and listen to them and trust them. I understand why in one of my videos, one of my commenters made the comment that, well, why should we trust you? You don't know everything. I never state or ever stated that I know everything. But the things I do know of, that's what I speak about. That's the lane that I get into. Something that I know what I'm talking about. Otherwise, I take the advice of our Honorable Minister Farrakhan. I left it at the very end of my video that I did about Tariq speaking against Grandmaster Jay and NFAC. At the very end of that video, there was a message by our Honorable Louis Farrakhan about, if you don't know what you're talking about, shut up. See, I go on that advice. So lastly, I'm just going to say, overall, reparations, Dr. Fauci and anyone else listening to this broadcast. Reparations is what we're demanding. Reparations is what's owed to us. Reparations is front and center on the table, nothing else. Reparations. Don't forget to like and share this video. Black World TV, the new black media. We'll see you in the next broadcast.